Welcome back.
Thank you. Thank you.
Nice to see you. We were talking before the show. Dr. Polasani's been here since
99.
1999. And I think
Since
that's
a
when we
while.
first met.
Yes,
Yeah.
exactly.
Well, I know you have a lot of very appreciative patients throughout the area for all the help that you've provided them. Today, I wanted to talk to you about something that seems to be pretty much hitting the whole country, and that's a flu. Is it of epidemic proportions?
Yes,
Yes.
the flu activity has been high than it has been in the all season. There are a lot of cases. Patients are going to emergency rooms and getting admitted. So flu, not only influenza, but also even COVID-19 also on the
Still COVID.
rise. Yes, still COVID.
Not going anywhere.
Not going anywhere. But the RSV is lesser compared to all these other viruses.
Hospitals full right now?
Hospitals are full, and even more admissions, especially people are having underlying health issues, asthma, COPD, and cardiac issues. They're the one getting admitted.
Well, I
and
think what's
being
scary to people is, everyone's had the flu at some point, and you get over it. Most people. What gets someone into the hospital? What is it about the flu that gets to such a serious point?
See, mostly the breathing issues, high fever, and lethargy, and people have underlying conditions. They have breathing problems and get admitted for supplemental oxygen, IV fluids, getting for dehydration, things like that.
How does one know if they should go to the hospital or the ER if they have the flu?
Well, again, high fever, more than 103 degrees Fahrenheit temperature, and shortness of breath, wheezing, a lot of congestion, are not able to take, easy breathing.
Mm-hmm.
Also, their skin is turning bluish, like a discoloration, lips turning blue, especially in children. That's when they need to go to the hospital.
Someone might be noticing that, oh my gosh, there's something wrong with you. You need to go to the hospital. But if you can't breathe, if you're struggling with breathing, don't even think twice
Right.
about it.
Exactly, yeah. And nowadays, I think most of the people are having their pulse oximeter. They can check their oxygen at home, and if it's falling below 90, they have to go.
We've heard 16,000 people in the United States this year have died from flu. These are people with, as you described, the underlying conditions.
That's correct.
Wow.
Yeah.
It sounds like, when we had COVID, we were having so many people that were hospitalized and dying. Is this unusual? Are we experiencing an unusual flu strain this year?
Yeah, the flu strain changes every year, but the antigenicity is higher this year, getting sicker more. It's lasting longer, the symptoms. Yeah, it changes, strain changes. But now also the people are not getting the vaccines. I would definitely recommend that. That's a problem. That's why it's higher in the community, the flu, not getting enough vaccination. And also, people are more indoors, transmitting each other easy,
Mm-hmm.
And not washing their hands properly after touching surfaces.
The vaccine, it seems like with COVID, that's when skepticism about vaccines started to permeate throughout the country.
Right.
But they're safe.
Yes. Yeah, COVID, we thought, people may have more breathing issues, but not as bad compared to the influenza virus, cause more breathing problems. And also, of course, RFC too, especially children under 6 years of age and adults above 65 years of age.
And
They suffer more.
I think when you get the vaccine, you get asked some questions about allergies. Are there some things in a vaccine, maybe the fluid or the latex or whatever that could cause an allergic reaction when you're getting a vaccine?
It's pretty rare, but there's some ingredients in the vaccine, not the actual virus itself, but the additives that keep the vaccine more staying antigenicity longer. Those are the one causing some allergic reactions.
So we can get COVID vaccine. There's still a active current COVID vaccine.
Definitely, yeah. That's the number 2 right now this season, other than the flu. And then the
How about
RSV is the third one.
RSV?
Yes.
Can you get 2 or 3 of these respiratory issues all at once?
In one all at once? No, that's
No.
not possible. No.
You can't be sick with COVID and RSV at the same time?
At the same time. It's possible, but not no.
Okay. Pneumonia. Is pneumonia related to any of these respiratory issues like RSV or the flu or COVID?
Yeah, the pneumonia is more bacterial. The Streptococcus pneumoniae or Haemophilus influenza, those are the bacteria. People get also, especially with a compromised immune system, they get pneumonia. Older people, younger kids like infants, they get pneumonia, but they get high chills and fever. A lot of people say when the patient come to my office, okay, I was diagnosed with pneumonia, but actually that's not true most of the time. Pneumonia, people get really sicker, high fever, lethargy, body aches and all that. So most of them, they have either bronchitis or some kind of just a viral infection rather than pneumonia.
The Pope is being reported as having pneumonia in both lungs right now. He's hospitalized. They're probably right.
Yes.
Yes.
Oh yeah, because I'm sure your chest X-ray done or CT scan, they can see the changes in the lungs. Yeah.
Is it too late in the flu season to get a flu vaccine?
No, it's not too late. You can still get the flu vaccine.
So
The flu can be until April. Yeah. From late fall until April, it goes on.
And we're still passing it the way we are passing
Yes.
all the, yeah.
Sure. Yeah. It's still going on. People are still getting admitted to the hospitals.
One of the things that we've noticed is an increase in the number of products that are promoting gut health that either have what's described as gut-friendly bacteria or some other components that are to improve your gut health. What do you think about these types of products?
Yes, especially since we're using antibiotics so often, and many, not just 1, 2, or 3 antibiotics that can killing the normal bacterial flora that maintains our gut health. So then pathogenic bacteria takes over, causing infections. The GI tract, also diarrhea, even other symptoms too, pain, bloating. So now taking the probiotics definitely help to maintain the gut health, and also our eating yogurt also helps. Some people patients are developing C. difficile infection. It's kind of a coating of membrane on the GI tract, so that we don't get nutrients, and then more diarrhea with that too.
How do you know if you should be considering taking probiotics, or is this something that should be good for anyone?
Yes, should be good for anyone. Probiotics, yes, especially people taking antibiotics often. Yeah, I would definitely recommend that.
So we naturally have bacteria in our body, but the antibiotics, they attack what's called good bacteria that might be part of our digestive system.
Yes, the antibiotics attack the good bacteria and kill those bacterial flora. Those bacteria actually prevents pathogenic bacteria growing in our GI tract.
So if someone is on antibiotics, should they supplement?
I do recommend that to my patients.
Really?
Yeah, take the probiotic. Especially if you're taking 2 or 3 antibiotics a year, then yes, they need that.
Is that a daily, becomes part of your daily regimen? You have the yogurt every day?
Yeah, yogurt every day helps, especially doing that, maybe a month or two during the antibiotic course.
All right.
That will help.
Well, let's hope everyone that's watching stays healthy and safe the rest of this winter flu and cold season. Appreciate your advice, and thanks for coming in today.
Thank you very much for having me.
You bet. From Asthma Allergy Center, Dr. Ravi Polasani.